Everybody's back, so we'll reconvene in the afternoon portion of our work session for today, Tuesday, August 11th. And the next item on our agenda is a COVID update. And our Director of Health and Human Services, Marnie Kyle, is on a well-deserved vacation. I just want to put in my plug for ensuring that all of our employees feel supported in taking a vacation, but particularly this year, very trying time here with COVID, and I appreciate everyone's flexibility and nimbleness. Tricia Mortel, our Deputy Director of Public Health.
Public Health Division Manager.
That's it.
Yeah.
Anyway, she's the next go-to person, that's for sure.
Yes. And we assured that Marnie Kyle, the Department Director, is following all the CDC guidance for traveling. So, so it's important for her to do all the same good things where she's at. And she promised she would do that. So I'm here today, Commissioners, good afternoon, to provide you some updates on our COVID-19 situation and the work that we're doing. And do we have someone doing the slides today? Okay. Next slide. So Marnie's slides usually set you up with what are the numbers looking like. And so as of the poll yesterday, are the state numbers, 21,488. Again, grateful that we're in the state of Oregon. We're still seeing low numbers comparatively to other states. Sadly, have lost 357 lives in Oregon State. And as we have been trying to share with you, one of the important things is to continue to look at hospitalizations and what's happening, particularly as we start to swing into flu season this fall. That will be really important. So the last 7-day average was 11 with a downward trend. Next slide. So here's what's happening in Washington County, comparing the last couple of weeks. The first four data points are cumulative. So we have now total confirmed cases of over 3,000. Presumptive are those cases where we've not had a test, or we've have a test that's potentially inaccurate, but we still think they may have COVID. Of 94. Total hospitalizations, 243, and again, sadly, 25 deaths in our county to this disease. She also provides you with a weekly snapshot of the work that we're doing to protect people in different settings. And these are what we call outbreaks. And in this situation, outbreaks are very small numbers. We begin an outbreak at 1 or 2, just to give all that support to a business or an agency. So we are working with 20 long-term care facilities. As we all know, those who are likely to become severely ill or lose their lives are elderly. So this is an important area for us to put some energy. And I didn't bring any data on this, but we have been working with OHA across the state, and particularly in our county, to do baseline testing at all long-term care facilities over the last couple of weeks. And there's new recommendations regarding testing for long-term care facilities. 2 additional congregate settings, so where people are living together. 25 workplace settings, and I learned right before I came in to see you today that 2 work sites will be named on OHA's website today, so they have over 5 cases, 2 of our Washington County businesses. And we do have some types of schools, daycares, camps open, and we have 10 that we are facilitating, supporting. So Catherine and I Chair Harrington and I were talking a little bit about all the work that is happening here. It's quite a bit in terms of the first thing we do is that notification, then working with the businesses or the organizations to help us determine who might have been in close contact with the individual that we're following, and then trying to ensure that they're following all the guidance that we have, the best guidance we have at this point. We are beginning, just like individuals, most businesses are very cooperative, and that's, again, grateful to be in Washington County. We are beginning to see some wariness, just like individuals. We're beginning to see a little bit of wariness, I think, with our agencies and workplaces. As this drags on, really not stumbling a little bit on some cooperation. So our business enforcement, our disease control team, and County Counsel Brad Anderson met today to discuss if we need to move to stronger enforcement, particularly for disease mitigation, because that's really what we're worried about. What are the tools that we have, and what are the barriers we have to really enforce things like face coverings and isolation and quarantine, making sure that employers are not requiring employees to come back to work when we've been telling them that they shouldn't be in the workplace. We have some ideas of what we'd like to uplift to OHA in terms of executive orders and language in our public health laws. So we'll be working on that in the next couple of weeks because we really want people to be protected in the places that they live, where they go to, if we have schools open in their workplaces. We need to make sure that everyone's following the guidelines. Next slide. You might have noticed that OHA released some modeling last week. It really is difficult. The modeling is very difficult because it's 3 scenarios. We stay the same, we go down, we go up. We look at it and use it, but it's not a very good crystal ball. But we have seen, if we think about where we've been, we did see those higher transmission rates in May and begin to slow down towards the end of July and the end of June and 1st of July. We had our highest weekly case count the week of July 5 with 328 cases that week. But this last week period with 726, only 236. So we had that high. You saw some 70s, daily 70s, and we're now down in the 50s and 40s. So we're cautiously optimistic, I might say. But we remember that it takes several weeks for us to see trends and to see those trends continue. So we need more time. One of the pieces of information in the modeling was something that they call the RE, and I actually forgot to write down what exactly it means, but what it's named for. But what it means is, for every case, how many other people become ill. So not the close contacts, but how many other people develop COVID. And right now they're saying it's 1 to 1, and that for them is a very good sign, and we're watching that number. We've been watching close contacts because we're looking at the body of work as well that we have to do and the amount of resources we need to spend on that. Right now, Washington County averages about 4 contacts per case. So that's a good number, it's low, and they range anywhere from 1 to 36. So we're hoping we do not have those 36 all the time. We're really wanting the 4s. And so that's the plea, I think, with our modeling to the community is keep doing the right thing, keep following the guidance of physical distancing, wear your face covering, clean your hands, and limit the people that you're around so that we can keep these numbers down. Next slide. So just to refresh our memories, what have we done since that high and then coming down? If you remember in June when we entered phase 1, we weren't enforcing isolation and quarantine for people that had tested positive or were close contacts because everyone was in stay-at-home orders. So we began ramping up our staffing to do that, to do the daily calls, the monitoring, to make sure we can help support people in isolation and quarantine. And that's in mid-June is, again, where the governor slowed entering into different phases. And then by June 25th had required face coverings for all of Washington County, and then by July 1 across the state. So this comprehensive approach to public health response is important, but the hard part then is we don't know exactly what is the one thing. And so it's not one thing. We have to keep up all of our vigilance around the things that we're finding can make a difference. Next slide. So where are we at with, and I'm going to talk about 3 different sets of metrics, I think, today. We have a lot of metrics now. These are the phase 2 reopening guidance, and we traditionally have had 2 or 3 of them in the green and a couple of them in the red every week that you've seen this. So our percent of tests reporting positives has downturned during this week period, but it's still above 5, so we're at 5.6 in this poll. We had an increase in that weekly period of 16% of cases, and we're still above the 30% mark for cases linked to another existing case, so those 2 we're not meeting. Hospitalizations continue to be low and a downturn. They've always been fairly low for us in Washington County, again, a blessing. And the team is doing a tremendous job. I don't think you've seen anything under 99% in terms of our ability to do 24-hour contact tracing. So a great team that they've put in place there. So now I'm going to share just some updates on some bodies of work. OHA has released a number of contracts, over 170, with a variety of community-based organizations. There are over 30 that will provide services here in Washington County. And the contracts are for daily monitoring. They call it contact tracing, but it's really that daily call, checking in with people. How are they doing? Are they staying in isolation and quarantine? For isolation and quarantine support, so making sure that people have food, that people can stay in their home, that they have cleaning supplies if needed, that type of thing, and community education and engagement. For me, that's probably the most important one. We now have 30 plus organizations who can help us get the word out. And they can get the word out with their connections to communities across Washington County, specific communities, immigrant and refugee populations, Asian Pacific Islanders, Latinx, farm workers, faith groups, older adults, people with disabilities, LGBTQ+, people with mental health or substance abuse disorders, people who are houseless. As you've seen from our PIO, we do a lot of communication, but it takes a lot of communication and it takes a lot of avenues and channels. So we're pretty excited that we'll start working with these 30 plus organizations to make sure that they are getting information out across their populations and groups that they work with. Next slide. Last week, I think, Marty brought information about EOC and Clean Water Services working together on PPE, and there's a program launched, and if I get anything wrong, Diane will jump in here, People Protecting People, so, and that's a lot of P's, because it's about PPE distribution to hubs. So a variety of partners, Clean Water Services and the EOC, and you can see the other named partners here in that collaborative. The EOC had about 150,000 KN95 masks that we had been working to get out to agricultural workers at state deployed those. Through this collaborative, they've gotten out 50,000 more of those, and they have plans to distribute the rest of them by the end of the month. Their deliveries to distribution hubs are every Friday from the Washington County PPE inventory, and they're planning to consider purchasing additional supplies that we do not have available through our state supply or are not allowed to provide through our state supply. In particular, they're finding that we do not have gloves in our stockpile, and so they're finding the need for gloves and continued need for sanitizers. So a great job, great collaborative, getting a lot of important disease support mitigation materials out there. Anything you want to add? Did I get it all?
Oh, that was really great. It really is a collaboration with the county and CWS, CWI to get and fulfill needs that are sort of folks that are in the gap. So the folks that can currently provide for their own PPE, they're doing it already. So this is really the food banks, Meals on Wheels, those types of folks that are serving vulnerable communities. Cloth masks is an interesting issue. We're trying to provide those to folks, but there is a gap in the availability of laundry capability in some of these folks, so we're trying to figure out solutions. So right now the KN95 masks are providing really great gap.
They're a disposable mask.
This slide really helps address my question and my information needs, so thank you.
Great.
Yeah.
Good. All right, next slide. So business enforcement. So this is not the disease side, but this is the how well our business is doing with the guidance. So we're receiving about 60 calls or emails a week, and the common questions are related to guidance in the governor's executive orders and guidance documents. There is some contradiction in what sometimes our businesses are told by the governor's office and versus what's on the website. So we're sorting through that, and we're doing a great job of working together to make sure, as you remember, we're the only 3, I think, I have to go back and look, in phase 1. So it's different than the rest of the state, and people are getting tripped up on that quite a bit. And so, plus, the governor's office continually looks at what can they change, what should they change based on the new information, and there's interest and effort to try to open more outdoor activities and businesses, but we don't have that in the guidance yet. So I think we'll be seeing some of that going forward in the next little bit. Common complaints are what you would expect: lack of people wearing face coverings, and then businesses that shouldn't be open in phase one. We pretty much, again, get cooperation, and so when we contact a business, say, you know, our county's in phase one, it's not allowed. They are closing, but we are having to take some enforcement activities probably in the next couple weeks, because businesses, again, are weary in terms of this long time in phase one for Washington County and some of the businesses that can't open.
Can you give me an example of a business that's not allowed to open?
Well, so most of the outdoor and indoor entertainments, so arcades, go-karts, skating rinks, pools,
Bowling
alleys, movie theaters. Pools have had a write-in campaign. We get a lot of emails from pools. Most of those are not allowed in phase one. And if you go anywhere in any other county that's in phase two, you'll see those open. So it's a difficult place for those businesses.
I was going to say, if you go to Seaside, you'll see the arcade down there is open. Any other facilities like that.
Right.
So are they in phase?
They're in phase two.
Phase two?
Yeah. You know, we're in our enforcement and disease mitigation team are in agreement with the governor's office and OHA that there are probably some outdoor businesses that would be safe to open. Even in phase one, you could do good physical distancing. You're in the outdoors where there's, you know, good air circulation. They could stage it so that they have a smaller amount. But businesses also have to make a decision. Is it viable for me to open economically? For example, we're working with a driving range, and they are still restricted to a certain number of people, and that might not be economically okay for them to open with that small a number. It might be just too expensive. So, a lot to think of.
Another case that came up that I was contacted about was with regard to an outdoor wedding venue. And given the numbers in the current guidance, indoor and outdoor limited to 50. So we had to do some work to help get the word out on that too.
Yeah, the size of gatherings has also been confusing for people. And does that mean 50 in one space or 50 in the whole space? Or next slide. This is maybe a newer update for you. So our Human Services received additional funding separate from the county CARES funding for mental health services. And they have launched a new program, the COVID Community Counseling Program. So I guess this is 3 Cs now. So they have 5 providers they've contracted with to provide counseling to individuals: Asian Health and Services, Lutheran Community Services, Western Psychological, Virginia Garcia, and LifeWorks Northwest. Services are provided in English, Spanish, Vietnamese, Korean, Chinese, and Arabic. They're conducting outreach to get information out about this program to places where those who might be impacted by COVID: pharmacies, testing sites, Meals on Wheels, food banks, 211 child welfare centers, and older adult centers. They're also beginning to reach out to those that we have in isolation and quarantine to provide these services. I looked at the numbers today, and I think we have almost 670 households in quarantine. So again, quite a bit of stress for those families that when they're asked to stay at home and to keep all their children at home and keep everyone safe. Another thought that they're having is to help at business sites when businesses are experiencing outbreaks. So this program is a great support across the community, and it's new enough that we really need to get the word out. So please share it with constituents. Next slide. So now I'm going to go into a couple of other metrics. Marnie brought forward information about schools, the Ready Schools, safe learners, and things changed rapidly over the last couple of weeks, and school districts have all now moved to online learning or distance learning because of metrics. So the metrics are, go ahead and next slide, that schools can open for in-person learning if there's a case rate in that county of less than 10 cases per 100,000 in 7 days. There's a positivity test rate of 5 or less in the last 7 days, and the state also has that same metric. And this is looked at a rolling 3-week period. So it was, I think you got this before we even knew what our metrics look like. So here's what our metrics look like. Go ahead and next slide. So for the positivity rate, neither the state nor our county are meeting the 5%. So we are in slightly above 5% as of the last date. And again, it's a 3-week rolling, so you have several weeks before we would even be considered to be in the 5% category. Because I added one today and I goofed up on I added it minutes before I came in here and I made a mistake. So, or I've got it August 10, so week starting. Yes, thank you. I will have to fix that because I have another presentation today. I'll have to double check if I did it on that slide too. But these are the last 3.
Yeah, the good news is the numbers are going in the right direction.
Yeah, they're not way above, but what you're going to see, the next slide is more concerning. Next slide. So remember that case count was 10. Here's where we're at. We're at 40 and 50, and this is what you're going to see in the metro region. The governor's office and ODE are releasing some new metrics, and they're coming up with 4 exceptions to these numbers, but they're really looking at rural and frontier and small school districts. And we have, the Tri-County Public Health Leadership has communicated to OHA with this metric. It doesn't feel like the Tri-County is going to have school anytime soon. So we are going to continue to discuss with them the metric itself and looking at, as other schools open up, what is that looking like, and is this the metric that we continue to have going into the future? They are putting in some conditions whereby kindergarten through grade 3 could have some in-person learning if the number was 30 or below. So again, thinking that age group in particular really needs that one-on-one social interaction with a teacher and others. So this will be an ongoing conversation. The other metric, Pam.
I have a question
Cheers,
that
yeah.
I've heard from constituents and also from, in all fairness, my own daughter, and that is when schools aren't open and bars are open, gyms are open, that's really the consternation I think that a lot of parents feel. It's like, where are our priorities? And I'm just going to throw that out there, that it's something that I do hear. And, when you talk about, well, you need to weigh the economy and all those issues, it doesn't always ring true to everybody.
Yeah, it's very difficult. Even when I talk about phase 1, phase 2 businesses, you could be safe in some of all those settings and you could be unsafe in some of all those settings. So I think we're learning as we go. Certainly in terms of school settings, there's some more challenge with transportation and cohorting of children. When you're in the older age groups, you don't stay in one classroom, you go to your different kinds of classes. So I think there was efforts to begin to think about that, but it was also a rush, and I think that was worrisome for many school educators and public health professionals. Is if we're going to do it, we need to be careful and safe. So I think we'll continue to learn as we go into the fall.
The other number that was in the news this morning was that there are 97,000 childhood cases of COVID across the country, and I don't know what that number means. Is that large? It sounds like a lot, but across the whole country, is it? Do we know what ours is locally?
Well, we still, I don't have the total numbers in front of me, but our highest rates are in the 20 and 30-year-olds. 20 to 40 is almost half of our cases. When you get below 10, we have very few cases. The other piece we don't know, though, is if we're not doing universal testing. We're still mostly testing for symptomatic. If children have COVID and do not become ill, they're not being tested. So do we have a lot of children with COVID and only very mild symptoms? We don't know. Some of the reason the OHA and Governor's Office are looking at the younger age group going back in is also some beginning information to say that maybe they're not contracting COVID at the same rate, they're not becoming as ill, and they may not be as much prone to making other people sick in that young age group. So it's under 10 that we're kind of questioning what's happening there. So the other, next slide, so the other new metric just last week, I think, COVID time is so unusual, was the watch list, so Multnomah County being on the watch list. This is not being updated on OHA's website, and we have not been able to get good information about how they're calculating this. But in general, we know what it means. So our epidemiologists, looking at our data, our sporadic case rate, remember, is that percent that's not traced. And remember I said it was over 30 in the few slides before. So we calculated about 34% in this time frame. So, we're not close to that 50 at this point, which is good. But 5 sporadic cases in the past 2 weeks. We've had 5 sporadic cases the whole time. So that, that number is one that we would probably never be under. So we'll wait and see what the OHA and the Governor's Office do around this watch list. Next slide, and this was out of order. I should have had this earlier. My apologies. Again, finishing these up as we speak. This was another piece of new work that I wanted you to get an update on. That's the Safe Sleep Village that just opened. In the last period of week, there's been 16 adults staying at the facilities. There are still some campers in a park, the Paula Jean Park, and Hillsborough is trying to encourage campers at that park to disperse or come to the Safe Sleep Village. We are seeing folks from some of the other areas like McKay and Dairy Creek coming, and really our staff are very hopeful that houseless individuals will see this as a good resource and participate at the village. And we are putting in place safeties so that if someone became ill with COVID there, we could then transport them safely to the respite shelter where we would care for, house someone who is ill with COVID or being tested for COVID. So really making that huge wraparound to just preventing COVID and then making sure we're not having spread anywhere like the Safe Sleep Village. So. I didn't look it up. That's Dairy Creek, isn't it? Over by our facility is Dairy Creek. I don't know Paula Jean, but I know it's a Hillsborough Park.
Yeah, I've never heard of that either from city's standpoint. When as mayor, I don't know where that park is, so I think you might be right. It might be an unincorporated, but it's close.
Oh, okay. Well, so I think that they are on park property in the most cases, and I'm not the most versed in this area, but some laws, in terms of us not being able to move people, but during COVID, we really have been trying to do that for disease prevention. But I think county council and Annette have brought that issue before you in the past about the fact that we really can't remove people in general. No, it's just.
That's correct, Commissioner Scouten. Actually, and you mentioned that there was a case that just came down yesterday from Grants Pass. It was a federal court case where they invalidated the Grants Pass ordinance for citation and arrest of people who were sleeping on public property. So that sort of reaffirmed the Boise case that we've talked about before. And so, for public property, we can only, remove people as long as they have a place to go, and we do have places to go now, so we should hopefully have some spaces available.
Thank you. All right. So next slide, I'm just always leaving you with the important things that you're all supporting and thanking you. As always, I have said this and I will continue to say this. If I have to be working in this pandemic, I'm glad I'm at Washington County with all the support that you all provide.
Thank you for all your work.
Any questions, commissioners?
One question. I asked this about 3 weeks ago or 4 weeks ago because I was hearing a lot of scuttlebutt about we were counting people who were dying of COVID that were in various institutions that really had nothing to do with it. And I was assured that wasn't the case, which then I parroted back to a lot of people who were asking. And now I find out last night on KGW they had a whole dissertation on it, investigation, and then I heard it again on radio today. There's a distinction in Oregon and Washington. The state of Oregon counts anybody who dies who has with COVID, even if that's not the cause. They can go get in an automobile accident and they said it's a COVID-related death. Is that correct? 'Cause
So that, as our chief epidemiologist shared with you, that is what Oregon is doing. We don't know how many across the state, in the state's death figures, would be considered not a primary or secondary, but would just have COVID listed. She brought before you the numbers specifically for Washington County, and it's not the issue for us. Every one of our cases, it was either primary or secondary cause of death, but there could be some in the Oregon count based on how the Oregon data is being pulled.
I like the idea that they start to say they died with COVID versus of COVID. And it's a problem because we're trying to give information to people and calm them down, and then
Right.
have these telecasts, which
Yeah.
maybe don't tell the
They-
entire story.
Yeah. News.
So just for your information, Paula Jean
Thank
Park is east of Cornelius Pass and south of Baseline. So it's probably,
It's listed as a Hillsborough Park and not a THPRD managed park.
right. So yeah, it is a Hillsborough Park. But so that's generally where it is. You know where Brown Junior High is?
Yeah, yeah.
You go east of across Cornelius Pass, and it's out in that neighborhood.
Well, again, Annette, who does all this great work for the county, is really, working hard to make sure that people are aware of the options, but acknowledges that people have been living in these areas for several years, and it's very hard to make them move.
I was out last week. Is the safe sleeping area open?
Yes.
Yeah, and do
It
you know
opened
what
it-
the, how many people are
16
out of
50
50?
is the capacity.
We got a
Practice
spot
on
for
here.
you over there, Pam. We picked out one in the shade.
Oh,
So,
thank you.
yeah.
Folks have to be cleared through our Health and Human Services team, so homeless people can't just show up and say they want to be there. So that's all part of the homeless
just wondered where we
outreach
were on that.
connection.
We got a tour last week.
Yeah. I heard it's very nicely set up. Didn't get there yet.
Yeah, it is a very nice setup. Going back to the statistics, the 10 out of 100,000 and 30 out of 100,000.
Yeah.
Is that kind of a national consistent statistic?
So,
Ours.
yeah, so that is not national. Every state is making decisions on their own data points, and that is a conversation, and we shared with Chair Harrington at a conversation with OHA and the governor's office that we'd like to have a conversation about some of these metrics, because they were made at a time when we're still learning about COVID, and they may not be the best metrics. As you've heard from us, we think that the way that they calculate trends in hospitalizations is not that useful, but it's a major metric. I've seen some suggested metrics from our academic partners that are low, that are different. So we hope to have in the next few weeks, and we're assured by Director Allen and Dr. Seidlinger that we could have more conversations about, are these metrics the right ones? Are they capturing what we should be concerned about, or should we modify them? I think always when metrics are developed and put out there in the public, there's this hesitancy to change them because it confuses people. But this is such a new disease that we need to be diligent in making sure that these are the right things to measure before, and not just continuing down the road. And that's why we are saying, is this the measure we're going to keep for the metro region, because our rates are likely to be higher than that for quite some time.
Yeah, and I think that's what my concern is that we're basing these significant decisions on statistics that may not be a good reflection of the risk that we take, and it's harmful. It's not only harmful to businesses, but all the kids that cannot go to school and everything else that goes on. So I want to make sure that if we're going to hang our hat on a statistic, and that we've got some good data that says it's a good one.
Yeah, and Dr. Seilinger and his consultants looked at data from other countries when they were opening schools, and their numbers are so much lower than ours. So I think it's a cautious approach, trying to find an area where we feel that it would be safe, because most other countries have been able to reduce their rates much lower than this, and to be able to open their schools.
Well, New York City, for starters. New York City's in phase 4. And yeah, they're talking about opening up their public schools. And so that's significantly different than we are.
Yeah.
Any other questions, commissioners? I'd like to add a couple of things. At the Regional Solutions meeting last Thursday, there was a real focus on schools from early learning all the way up through post-secondary. So what we heard is the early learning division will be posting new guidelines this week that will be effective September 1st. They're expecting to have those out on Friday of this week. The K through 12 reopening metrics, there's updated guidance this week, and we heard Dr. Seidlinger was reviewing those and making final recommendations to ODE yesterday and last night. So they are looking at the metrics. At our post-secondary institutions, they noted that registrations are actually going down, which is backwards compared to all prior recessions. So that was really surprising. As I mentioned earlier, we had a very good collaborative meeting with the director of OHA and Dr. Seidlinger last night. I want to thank you, Tricia, and the other members of not only the Washington County team, but also your peers that you're working amongst the 3 counties for advancing the number of items that you had us provide and present as systems changes, partnership, communications, and then some other. you've all been working very collaboratively, learning about this new virus over the course of time, responding to community needs, and really putting your best science-informed thinking forward and working with OHA for the betterment of our community. So very productive meeting, but I know that there's the follow-on work that you and OHA have committed to, and I would just want to thank you in advance for continuing to do that as we continue to navigate what it's like to live with this virus.
Thank you all.
Yeah, good job. Thank you very much.
I also
Good.
wanted to add, one of the learnings from that meeting last night is that the state did invest in a public outreach campaign to the folks in the 20s as well as in the 30s. Wyden and Kennedy put that creative campaign together. Dr. Seinlinger mentioned that, or maybe it was Director Allen, Pat Allen, I can't remember which now, that they haven't quite seen the numbers go down in terms of the cases yet. As a result of that, they haven't gotten the full report yet on the outreach. And as we know, our own staff is investing in additional outreach as well. Since from our public health team, the cases that we're seeing are either workplace settings, some family gatherings, and increase in the number of cases in folks in their 20s and 30s. And as you mentioned here, half of the cases in Washington County are from the 3 different decades, 20s, 30s, and 40s. Great. Thank you, Tricia. Really appreciate it. We'll move on to the next item on our agenda, which I'm afraid I'm going to skip over one. Nope. We're on to the last item, I-205 and I-5 tolling projects update. Hello, Chris.
Oh, hello. This is a topic that's unlike anything you've talked about yet today.
Yay!
So today we have the ODOT team with us on Zoom to give you an update on the I-5 and I-205 tolling project, in particular the I-205 project, because that's one of the 2 that's moving forward first. We have Lucinda Boussard, who's the tolling project manager with ODOT, and 2 members of the consulting team, Heather Wills and Matt Delata. And they should be right there. So they will discuss the initial decisions coming up regarding the purpose and needs statement, the performance metrics, and the alternatives for evaluation in the national, the environmental assessment that they're going to do. And really, this update is intended to provide you with an opportunity to ask questions and better understand the issues that you would like to see addressed in this study, and help shape your position throughout this process. Commissioner Rogers represents the board on the Region 1 Act. And in addition, we have our Amanda Garcia-Snell is on our ODOT's Equity and Mobility Committee, and we have other staff that participate in some of the other ODOT committees. And so I'm sure you know that, while I-205 is not physically located in Washington County, I-205 is used by many commuters, freight, and many other trips that have an origin or destination in Washington County. And further, while decisions about I-205 by this tolling project are likely to set precedent for others, whether it's on I-5 or additional segments, or even on additional roads. So as you'll see, the tolling program work really presents a lot of new policy choices, and people are going to be asking, where is Washington County on this? So this is a chance for you to weigh in. And it's hard, because I have to kind of look back. It looks like everyone is here, so I'm just going to turn it over to, I believe Lucinda is going to start.
Thank you to the 3 of you for joining us in this meeting. I apologize for our delay, and if you were able to learn something more about our response to COVID here in Washington County, all the better. So take it away, please.
So thank you very much. And yes, that was a very interesting conversation. And thanks for allowing us to listen into it. So I'm Lucinda Broussard, I'm toll program director with ODOT. I have with me Heather Wills and Matt Delata from WSP. They're part of our toll program team. We're going to do an overview of what's going on I-205. And then we're going to do a little deeper dive. As Chris was saying, there is a National Environmental Policy Act, an environmental review happening now. We're in a 45-day comment period. So we want to make sure that we get information out to everyone so they can provide your comments on where we are and what we're doing. Matt's going to do a deep dive. He's the analysis guy, so he'll be doing he'll go through the alternatives that we've been looking at since the value pricing feasibility analysis. And he will have we have a couple of recommendations through that, but Matt will be able to go through a lot of the data with you. So thank you very much. Appreciate your time. Heather, next slide, please. Next one. So here's the project that we're talking about right now, I-205. That gold is the Abernathy Bridge. We're talking about tolling all lanes in both directions from OR 213 all the way to Southwest Stafford Road. So this is the project limits that we're talking about this afternoon. Next slide, please. During the value pricing feasibility analysis, which happened in 2017 and ended in 18, there was House Bill 2017 talked about tolling on the corridors for I-5 and I-205. The value pricing feasibility analysis looked at all of those and looked at the whole corridor. And then these were the recommendations that came out. The I-205 from OR 213 to Stafford Road, or Stafford Road to OR 213, and then I-5 from Multnomah to Going. So that's what came out of the feasibility analysis. It really took something that was really broad and brought it down. The recommendation was smaller portions of that. What we heard during that time, if you want to go to the next slide, because we've heard it since over the last 3 years here, the things that we've heard most, and I will tell you it's about transit along the corridor, tolls not being equitable, and diversion are kind of the 3 things that we're really working towards. The first one that you see there, including where and how revenue is used, is one of the ones that we're taking up with the Oregon Transportation Commission. We have a recommendation and an action item for Thursday, and it's revenue collected on a corridor stays on the corridor where it was collected. So that's one of the ones we're bringing forward this week. The other 3 that I mentioned, the transit, diversion, and income, we have been working towards those also, and took them as questions instead of comments. What could we do about that? So equity, the tolls are not equitable. We do have an equity and mobility advisory committee that we've set up to look at tolls and actually apply an equity framework to tolls. The transit, we have a transit and multimodal working group, and it's comprised of region folks throughout the region, and they help. I think we're trying to identify where transit is and then what are the needs of transit from those communities. And then the last one is diversion, and actually Matt will talk a little bit about it from a very high level, but once we get into the environmental review process, we'll go into a deeper dive regarding diversion in very specific ways. Next slide, please. As I mentioned, we're in the environmental review process. We started on August 3rd. It's a 45-day comment period is what it starts off. And it's asking, what's the purpose of the project? And for I-205, it's a couple of things. It's, I'm sorry, it's revenue generation and congestion management. So the purpose, and those are our goals. So the purpose here is how do we, so it's interesting. The purpose is those 2 items are really the objectives of what we're doing. And we're looking for, during this time, the feedback. We've done a lot of work. We've done a lot of analysis. We've come up with the alternatives, and we really jumped. I would say they springboarded from the value pricing feasibility analysis. And we've moved from there into 5 alternatives. But what we're trying to do now is after we've reviewed those, we've done additional analysis and come up with 5 alternatives, and we need feedback. I mean, are these right? Is what we're thinking correct? So the 45 days, we're looking for comments, questions. We're definitely out and about talking about it, and we're interested in hearing what people have to say. Next slide, please. For I-5, just going to touch on it really lightly. We're in a kind of what it says, planning and environmental linkages. It's really like a pre-NEPA. I-5 is the span of different alternatives is so wide. We need to narrow that down. So we will be looking at the endpoints and trying to come up with the alternatives for I-5, like we've done on 205. We're looking at doing public engagement, kind of the same idea that we're doing now for 205 with the public, asking what those might be and how do those look in the fall. We also will be giving that to our Equity and Mobility Advisory Committee so they can weigh in for I-5. And then, of course, more outreach and to other communities. I mean, we are really trying to reach communities that have been underserved and underrepresented in what we're doing now. Next slide, please. So here's our timeline. Orange dots are the starts of NEPA. And as you can see, we're in 2020 for the 205 third quarter. And by the time we get done with, this is what FHWA needs to do to start us off. We're in the comment period. We'll develop that, the purpose and need statement out and provide that to FHWA for them to get the process started. And you can see on 5, the one below, 2021, we're looking at starting the NEPA process or the environmental review process for I-5. Next slide, please. Here's I-205, and it's basically, it's the same thing I showed you previously, but it's dedicated to I-205. And if you can see, notice at the bottom in the teal or the blue, that it's all about public outreach and hearing what the public has to say. So all of our public engagement, which is now, we say public open houses, but I'm believing that next year that would still be virtual open houses, which is what we're doing now. So a lot of virtual work is what we're doing. Next slide, please. Oh, Heather.
Thanks, Lucinda.
Sure.
So I'm going to go into a little bit more detail, as Lucinda said, on the purpose and need and goals and objectives. Prior to publishing the draft purpose and need and goals and objectives for public comment, we did a lot of coordination with the regional partner agencies, including many of the jurisdictions within Washington County, and Chris was at many of the meetings. And we went out to the public, incorporated a lot of the comments that we heard during that process. Still, it's draft, so we're still in this continuum of wanting to hear feedback and continue with the revisions. So as Lucinda said, there's a dual purpose for the I-205 toll project to manage congestion and raise revenue. That little dial in the middle kind of illustrates that, there's a sweet spot in your toll rate, which will be determined after the environmental review process by the Oregon Transportation Commission, where you can do both, manage congestion and also generate revenue for congestion relief projects. Next slide, please. So ODOT, as Lucinda said, ODOT is centering equity for the decision process. We have the Equity and Mobility Advisory Committee, and they're guiding our approach through recommendations. They're going to be convened through the through the I-205 and I-5 environmental review processes. Additionally, we have goals and objectives that are equity focused, and that leads to evaluation criteria and performance measures that we use to evaluate the different alternatives, which Matt is going to talk about. In terms of equity in the purpose statement, which is a comment that we heard during that preliminary coordination and collaboration with our partner agencies, the purpose statement is very transportation focused, and it's used to narrow the potential set of alternatives, and is typically very specific. And given that ODOT is currently sort of figuring out what their equity definition is and how they want to approach equity. We thought it was a lot more flexible to be placed in the goals and objectives because we can use a lot of different definitions and performance measures in order to evaluate equity in the toll projects. Next slide, please. So these are the statistics that support the project need. We have heard, so the things that are in blue are things we added through that collaboration process with the regional partner agencies. We have heard that the greenhouse gas emissions one maybe should go into the goals and objectives. So that's something we'll consider after this. But again, this is all draft and we're asking for comment on that. Next slide, please. And these are the goals and objectives. So we do have some materials on our online open house that go into a lot more detail about the goals and objectives, as well as some of the performance measures that would be used to evaluate how well an alternative meets the goal and objective that we've identified. Again, everything in blue are things that we added through that collaboration process. And the equity goal is the very first one, and we tried to really, I mean, really all of these will be seen through an equity lens. You know, when you're talking about additional traffic rerouting, is that rerouting happening in neighborhoods that are bearing more of a burden that are maybe communities of color or lower income communities, and trying to evaluate and understand what that might look like. Next slide, please. So some of the next steps in the environmental review process: 45-day comment period. We take those comments, we work with Federal Highways, and we will publish, Federal Highways will publish the final purpose and need, as well as the range of alternatives to be studied. We've invited participating agencies. So Washington County has received an invitation to participate in the process. And that just allows a little bit more official, an official part in the environmental review. So we'll be at one of the first things out of the gate would be asking for comments on our methodologies on how we're going to assess the impacts. So looking at all of the different disciplines: air quality, noise, environmental justice, communities, etc. And then we'll publish the draft environmental assessment. And after that, there'll be another formal comment period for 30 days. But as Lucinda said, there is public engagement throughout the entire process. Next slide, please. And I'm going to turn it to Matt.
Thanks, Heather. So I'm going to walk through our alternatives analysis for I-205. So there's really multiple stages in this project. So it's like Lucinda said, we're building on the value pricing feasibility analysis, which looked at regional concepts for tolling on I-5 and I-205. And the piece of I-205 that came from that was called Concept E. And the findings from that study essentially said that tolling can manage traffic and generate revenue on I-205, the primary purpose of our project. So we took a step back from that. Concept E was a single point toll on the Abernathy Bridge on I-205. We took a step back from that and said, are there other toll configurations, other gantry locations that can have better outcomes than that? And so that's the screening level that we're at right now. So we're really leaning on a technical basis on the Metro Regional Travel Demand Model. We're looking at 2027 results, which I'll run through some of those today. But we know we're not answering all the questions to the level analysis and identifying all the impacts. So that's what will happen in the environmental review. So at that stage, we're looking to narrow down from our 5 alternatives to 2 or 3 for more detailed study. That's what we'll figure out. What are the impacts? What mitigations are needed? We'll look at not just 2027, but 2040 as well, and use more refined tools that we're currently in the process of developing to evaluate all these impacts. Eventually, of course, the goal is to get to a single preferred alternative, and we recognize that kind of through that environmental review, as we identify impacts and mitigations, we may need to tweak and refine that project to address those. So I'll go, next slide, please. I'll talk about the screening analysis. So again, we have 5 alternatives right now. The first one is coming forward from the value pricing feasibility analysis. That's concept B, alternative 1. It's a toll on the Abernathy Bridge. That's pretty simple to understand, but there's some drawbacks. There's limited ability to manage traffic demand and congestion outside of that single toll location. We also observed in the value pricing feasibility analysis there was a concentrated rerouting pattern emerging through Oregon City downtown and across the Oregon City Arch Bridge. So alternative 2 was tolling the Abernathy Bridge with gantries on either side. This was really a tweak to alternative 1, a refinement of it, where we designed to limit rerouting of through trips on I-205. Anybody who might get off of I-205 and then hop right back on after avoiding the toll. The third option kind of splits the toll between 2 different locations. So the first one on the Abernathy Bridge over the Willamette River, and another on the Tualatin River to the west between east of Stafford Road. So again, that splits the toll amount between 2 locations. So for a through trip, they're essentially paying the same amount, but if you're getting on or off of I-205 somewhere in the middle, you'd essentially pay half that amount. The fourth alternative is segment-based tolling between Stafford Road and Oregon 213. There's 4 different segments here. So again, the same concept, just extended, breaking out the cost over 4 different segments. This alternative is the most flexible for traffic operations management in the long term as demand changes, but it is more complex to communicate that kind of pricing structure to users. Our final alternative is a single zone toll between Stafford Road and Oregon 213. So that's one toll, whether you're a through trip or a local access trip, and there's multiple toll locations. So next slide, please, for those that are more visually inclined. This graphic kind of identifies each of those concepts. So alternative 1, the toll on the Abernathy Bridge, also alternative 2. Alternative 3, splitting the toll between the west location and the east location. Alternative 4, 4 segments, and then the single zone toll, where you basically pay at each entry point, whether that's a main line or on one of the on-ramps in the toll zone area. So how do we evaluate? The next slide, please. Our evaluation of these concepts is, this is the list of performance measures we're using to screen these alternatives. So we're looking at transportation system demand, which refers to how many vehicle miles traveled and vehicle hours traveled around the system. We're looking at the volume on I-205. We're looking at diversion, so how volumes change on some of the parallel local street system, how there are shifts to other modes of travel. We also looked at cost and revenue. We have a few different criteria here. The most important one is what kind of the net toll revenues and what kind of revenues could be available to provide funding for transportation improvements. We also looked at some qualitative criteria about how difficult it is to implement and operate these different toll configurations. Next slide, please. So on I-205, our 2027 model results are telling us that there would be a significant volume decrease on the tolled segments of I-205. These generally vary between 15 and 30%. Important to note that this diversion, the decrease in volume on I-205, is worse during the off-peak hours than during the peak hours. During the peak hours, we see that shifting more to like 10 or 20%. It's also important to note from the diversion perspective that immediately outside of the tolled area, there's a much lower decrease in volume. So between I-5 and Stafford Road, we see a 10 to 20% decrease, and north of 82nd Drive, more like a 5 to 10% increase. So this will be relevant when I go through some of the regional diversion, the big picture. Next slide, please. Okay, so we're saying there's going to be a decrease in volume on I-205. Well, where does that traffic go to? Some of it will go to reroute and use other roadways. That happens both at the regional scale, which is generally similar across all of our alternatives because we generally have very similar toll rates for through trips. And then locally, where we see some pretty significant differences between our alternatives. So near the tolled area, we can see very different rerouting patterns emerge. But not all the traffic is just going to move to a different roadway. There's also a transportation demand management component to this. So that means people may change their travel behavior, what time they travel, where they're going to, or how they're getting there. So what do our results so far tell us about that? So we looked at the 2027 demand changes, and we do see the potential for a reduction in single occupancy vehicle travel, people driving alone. That shift is primarily going to what we call high occupancy vehicle travel, so people sharing their rides. That's about 4,000 to 5,000 additional trips per day where people are sharing. We did see some shift over to transit, but it was a relatively small shift, a fewer 500 trips per day, using the assumptions that we have built into our 2027 modeling work. These shifts in demand are generally the same across our different alternatives. Next slide, please. So I talked about the demand from the perspective of mode shift. Well, what happens to the roadway system and the roadway network? In all of our alternatives, we do see a reduction in overall vehicle miles traveled, how much people are driving on the roadways. We're also seeing a reduction in vehicle hours traveled, so the time people are spending driving. That said, there is a shift evident. We looked at the VMT, vehicle miles traveled, and VHT, vehicle hours traveled, both for freeways and for non-freeways. And we are seeing a shift in travel from freeways to non-freeways in response to the toll. Overall, it's not changing the regional picture all that much, but it can be noticeable in the surrounding area, which begs the question of, okay, so which local roadways are going to be impacted? What are the diversion and rerouting effects? So I'll jump through those next. Okay, so it's logical to think, okay, there's going to be a toll on I-205, so trips are going to jump over to I-5. We're seeing that there's not as much of that as maybe one might expect. We see relatively small shifts of less than 5%. These are over the course of a day. Some locations closer to Portland can see some increases. Closer to I-205, we can actually see some small decreases. This is daily, but during the peak hours, we see the shift is actually pretty negligible. There's a lot of congestion on the existing system, so there isn't a lot of room for additional vehicles to jump onto I-5. Next slide, please. This small shift is also evident on some of the other regional roadways. So very small shifts, 0 to 2% when we look at Highway 26 and 217, further up on I-84 and I-205. Very small shifts on the regional scale across all alternatives. Next slide, please. We start to see more of a shift as we get closer to the tolled area. So in this graphic, we're looking at a location in Lake Oswego, Oregon 43, south of Terwilliger. They're seeing some shift of 5 to 10%. Looking on Stafford Road between Wilsonville and I-205, we actually see a volume decrease as fewer vehicles are looking to access I-205 due to the toll. In downtown Canby, we're seeing a rerouting pattern emerge where there could be a potential volume increase. This is a pattern we've seen for travel further to the south in the previous value pricing feasibility analysis, and something we'll have to work through and address in the environmental review. Next slide, please. Again, in the kind of vicinity of I-205, Borland Road tells kind of an interesting story. So east of 65th Avenue and east to Alton, we don't really see much of a volume increase. The piece of I-205 between I-5 and Stafford Road is not tolled, so we don't see much of a shift onto Borland Road. But if we look at Borland Road east of Stafford Road, we see some of the alternatives have a potentially significant rerouting effect occurring on this part of Borland Road. Next slide, please. Oregon City. This is kind of one of the primary, if not the primary, rerouting pattern that emerged in the value pricing feasibility analysis for tolling the Abernathy Bridge. All of these alternatives would increase traffic in Oregon City, but there's a significant difference between them. Alternative one, that single toll on the Abernathy Bridge, has a more concentrated impact on the Arch Bridge and downtown Oregon City. Next slide, please. West Lynn is, from a rerouting perspective, is probably the most complicated story to tell. We see some locations with decreases, we see some with increases. It can really vary depending on the alternative that we're looking at. So really have to dive into the details there. Next slide, please. So there's always questions about rerouting, and so I want to kind of give an overview of our approach here. So in the feasibility analysis, it was pretty high level still. It was looking at the regional scale, identifying potentially impacted routes. In this screening analysis, we're trying to provide an additional level of detail. So not only are we saying what the potential scale of the impacts are, but we're describing in our technical report how that varies between peak, off-peak, and of course the daily shift. That's not the full picture. The environmental assessment will look at more detailed locations. So this screening analysis is helping us identify the patterns that are emerging. The environmental assessment will tell us, well, what happens during the peak hour? Do we need any mitigations to resolve any diversion issues that result in mobility standards not being met? So we recognize there's a lot more work that needs to be done, but this work and the screening analysis gives us a high level and preliminary look at impacted locations. Next slide. Okay, so earlier I ran through the evaluations that we've identified for the screening analysis. So those hit on those different categories of transportation system demand, I-205 traffic, diversion, cost and revenue, implementation operations. So this is a very high level summary of our work and our technical analysis. It's really oriented around identifying recommendations for what we're going to study further in environmental assessment. So next slide, please. So based on those, our recommendations at this stage are to advance alternatives 3 and 4 for further study. So alternative 3 again is tolling on the 2 bridge locations, and alternative 4 is breaking the toll between the 4 segments. We're recommending to not advance further alternatives 1 and 2 for further study, or alternative 5. The rationale for this is that alternative 3 is generally performs better than alternative 1 in most of our measures, while alternative 4 offers the greatest flexibility and potential to expand to a regional system in the long term, which was a recommendation from the value pricing feasibility analysis. Another benefit from our perspective is that alternative 4 allows local users to pay less compared to through trips, whereas alternative 5 has the same charge again for through trips as well as local trips. Alternative 5 also creates some concentrated rerouting impacts on kind of the edges on the outsides of the tolled zone area, including in Gladstone. And whereas alternative 4 sort of spreads the rerouting effect, so it has a wider geographic coverage, but generally less concentrated than what we can see in the other alternatives. So that's it for my summary of the screening alternatives analysis. All that information is available in the report as well.
Thank you, Matt. Thanks, Heather. Appreciate it. What's next? You want to go to the next slide? Just more presentations. We are trying to get out and talk about providing the update for the toll program and also eliciting comments. We are trying to make sure that we reach everyone so you can reach someone else to tell them about the 45-day comment period and that they can participate in some of our online survey. We're doing some webinars. We're going to have discussion groups. I mean, we are really trying to make sure that we provide the information so we can get comments back. Next slide. Thank you so much for your time. If you have any questions, we'll take those now.
Commissioners, do you have any questions? Commissioner Willie?
Yes, on the going back up to just a couple of slides back, initial recommendations for further study. Under the categories, have you prioritized or weighted those, which is the most important versus least important?
No, not formally. I think that it's relatively, we're trying to look at the big picture. We didn't identify that one is more important necessarily than the others. We did think a good bit about the implementation and operations one. That's sort of qualitative, whereas some of the other measures are more quantitative and based on the modeling. But we really tried to look at all of them. Yeah.
Okay, and I didn't hear, so I don't know if I missed this or not. Have you even tossed out our alternative tolling pricing? Have you tossed out what it's going to cost to? What's the toll going to be?
Oh, the toll rate?
Yes.
So the toll rates are set by the Oregon Transportation Commission, And that will happen after the environmental review process. Once we know where the toll gantries are going to be, they'll set tolls after that.
We also have to recognize as a state that we don't have any tolling. So there's a recognition that the very first project here in our state is going to be lifting up all subsequent projects, because it's going to be the one that figures out how we get tolling implemented for the first time ever, so that additional projects will likely have the benefit of being able to build off of that infrastructure, or so the theory goes.
That is a correct theory. And I would say that if I was part of Port of Hood River Bridge, they would want to claim that they were first in the state to do tolling.
Yeah, but it doesn't have the current electronic tolling that we have now, right?
They just put it in, actually.
Oh,
They did put it in this summer during this COVID crisis. A lot of people went to electronic. They were one of them.
excellent. Good to hear. Thank you. You learned something new today.
So you don't have to stop and pay anymore.
Commissioner Willie, I think it is a common question that comes up is, if you don't know what the toll is, how do you know what to model to be able to decide how much traffic is being diverted? And our modeling people could weigh in on that, but they pick a point. But that is often a question, well, if you don't know what the toll is, how do you know how much diversion you're going to get? So it's an estimate now, and they can tell you how they tweak that more in detail if you want more.
Matt, do you want to address that?
Sure. Yeah, I mean, that's absolutely true. For our modeling work, we have to make assumptions, and we make assumptions about the transportation network and travel behavior and the toll rates. So what we've done at this stage is advance those kind of high-level assumptions from the value pricing feasibility analysis. And the cost and rev, we were kind of seeking to essentially maintain the net revenue perspective across the different alternatives, so that wasn't a primary driver of the alternatives selection.
Commissioner Rogers?
Good to see you again. Yeah, it seems like only last week we had the same exact presentation and same slides as well. The only thing I would say is that we had a number of questions, several of them that just didn't have time to answer, and I asked listen to you to take all those down, what you did, and you're going to report back to the ACT meeting. I would encourage you, as you go around, to maybe develop the questions from other groups and then have some composites, because some of those questions were really good. I mean, they had to do with perspectives from different jurisdictions. Metro, for instance, the representative was concerned about doing I-205 and not I-5 at the same time. Felt that it wouldn't, there would be a lot of diversion if we didn't do them both at the same time. I was concerned, as you know, about too many tolling places that would slow traffic instead of moving it through. Clackamas County had a perspective. So the only, I guess, theme in all of this is that it would be interesting for this board, as well as all other boards that you present to see the questions that are coming from other areas, because they are different based on their perspective.
We can do that. That'd be a good slide. So yes, we can take that one up. Thank you.
Commissioner Scoutner Treese, nothing?
No, at this point,
You need to turn your mic on.
I just got this the other day to look at, to read through it. I guess I've had it for maybe a week. I'm not sure exactly how long, but it'll take me a little while just to sort of absorb all of it. There's a lot to kind of read and understand, and this is my first go at it, so.
I've read it before, and I still think there's a lot to read and understand in this.
Yeah.
I just want to say thank you. You presented to Westside Economic Alliance. You've done a great job getting out to the public into different areas, and I really appreciate that as commissioner. So thank you.
Thank you.
So I have a question on this slide, particularly with regard to eliminating alternative 5. Given that from the outset of the project, pretty strong articulation of seeing how tolling can be a benefit to the I-205 traffic volumes as well as influence travel behavior and transportation system demand. So we see in alternative 5 that for those two aspects, it's marked green for better. And then at the bottom, from my layperson's view, just looking at this very high-level summary slide, it's eliminated because of implementation and operations because it's quote-unquote harder and that much harder. But just because it's harder, given the benefits, why eliminate it? So I'm wondering if you could just help me understand a little bit more about why alternative 5 has been discounted. I'm not trying to lobby that it come back in, rather, I'm just trying to better understand its removal, that's all.
Yeah, I can handle that one. I think it's a really good question. Just from looking at this high level thing, it's a very reasonable question to make. And so there's a lot of nuance to the analysis, and then this is detailed in more in the transportation technical report. But one of our other recommendations is to kind of refine alternative 4 most likely, and potentially alternative 3 as well, to get some of those regional performance more like what we were seeing in alternative 5. So tweak those essentially, because with the toll structure of those and the gantry locations, they're more flexible, and so they can operate more readily like alternative 5. So when we talk about implementation and operations, we're referring to sort of the lack of flexibility that happens when you only have one single toll rate versus breaking up the toll rate and being able to have more control over how you manage congestion and traffic operations on the corridor. So essentially, we think we can make alternatives 3 and 4 perform better on the demand and the I-205 traffic side by refining some of those assumptions. On the implementation and operation side, one of the big drawbacks of alternative 5, again, you have one toll rate, so you kind of see more concentrated rerouting patterns emerge on the edges of those. On kind of the outside edges of those, because a short trip on through the tolled segment has to pay just as much as a through trip through the segment. So that's what we mean in implementation operations, that it's not going to work as well in the long run, that we'll have less control over managing traffic with just a single toll rate.
I follow that. Thank you very much. I appreciate it. Then my last question is, so I see that each of your slides includes the website OregonTolling.org. So if folks go to that website, then they'll be I assume they'll very easily be able to find how to go through your materials to participate online in the 45-day comment period.
Yes, we have an online open house there. So if you went to, you can go right to that site.
That's
Yes.
terrific. Great. Thank you very much.
Thank you.
Don't see any last questions. Thank you, Chris, for helping to get our speakers scheduled for us. And thank you to all 4 of you for hanging in there with the timing of our meeting. And thank you for staying healthy during COVID, too.
Yes.
Thank
you
you
for your time. Bye.
Thank you. Bye-bye.
Thank you. More to come on this one. Thank you.
Thank you, Chris.
Day you guys have had.
It's good to get this early, so thank you.
Yeah, no, this is really good. Thanks.
I
We're
thought that was
learning a lot as a community.
I thought this was a good question on alternate 5 and why it got taken out.
Yeah,
Because
did you
that's-
follow what he said?
Yeah, I did.
Yeah.
But that was a good question. I hadn't really looked at it, because if you just look at the color coding in there, well, 3 and 4 is the natural, but you got to drill down a little bit on that. So yeah, I agree.
No, he was able to address my question in a very reasonable manner for me to follow. So anything else, commissioners? Great. Up in your offices, you should have an updated version of the rolling agenda. Staff has put together a process for us to go through the review of that and get a hard copy of that at the beginning of each month. Okay? Terrific. Great. Well, that's it for today. Thank you, folks.